you were saying that people, if they can't get access to insurance, they don't have coverage. But
right.
if you remove the individual mandate, you are going to have people who are not going to buy coverage. They're not going to buy insurance. And so getting back to the Congressional Budget Office score, would you concede that there will be some coverage losses, perhaps in the millions, that there will be millions of people who will not have health insurance as a result of what you're doing?
Well, again, sure, except you have to look at the current situation. You are mandated by law to buy insurance right now under Obamacare. 13 plus million people have asked for a hardship exemption, and then 6.5 plus million people have determined to pay the penalty. So currently, if we look at the universe and say it's roughly 30 million people, only 9 million people engaged in the exchanges when required by law. The majority, almost 2/3, if my back of the envelope math is right, about 2/3 have chosen to either apply for a hardship exemption or pay a penalty. So
the mandate forces people to buy insurance, and if they don't have insurance, then you have the free rider problem in the system.
Right, but look at what's happening now.
So if you have free riders, and those folks
no, because the current
they show up at the emergency room, and then the health care is much more expensive.
But they do it right now. But my point, Jim, is that the way the system was constructed under Obamacare, they created the system to force people to buy plans that they did not like, that were mandated by the government in terms of what was part of the plan, what it had to cover, the deductible, et cetera, et cetera. And yet, roughly 2/3 of the people either paid a penalty or asked for a hardship exemption. They didn't do it. And so the idea is, actually, if you could bring down cost and choices and allow people to find a plan that fit their budget, that was tailored to their needs, there's actually a higher likelihood that they will find something that they want at a price that they can afford, as to right now, which is, I get a plan that I'm forced to buy that has a deductible that I can't afford, but I've got a cute little plastic card that I can wave around.
Will get you coverage.
No, that's not true.
If you show up at the emergency room, if you've been hit by a bus,
sure,
you're not going to be just paying out of pocket to the hospital.
But under any scenario,
you're going to have some sort of catastrophic coverage that will make sure you have insurance.
Thank you. That's a great advertisement for thank you. But that's exactly what the president's trying to do, because right now you've got of the attempt to get 30 million people covered, 14.5 million people applied for a hardship exam. They're exactly the people that you're talking about. Another 6.5 million people have paid the penalty and don't have it. So we have roughly 20 million people in this country who were supposed to be required to buy health care, that have chosen not to do it, who fall in exactly to the category that you're talking about. The question...
But that's that number is massive by the year 2026.
Right, and so the point that I'm...
20
hold on.
Americans.
But if they actually had choices and had a plan option that was down at a budget they could afford, there is a higher likelihood that they would buy a plan that was A, tailored to them, and B, actually that they could afford. So to your question about catastrophic, right now that's in most cases not even an option. In 1/3 of all the counties in the United States, they only have one choice. In 5 states, they have one choice. Can you imagine if they could actually buy a plan?
That talking point, but at least there is coverage in those states.
No, it means
of coverage.
Right, and in a lot of...
If you pull this away, then you're going to have people in a lot of states who aren't going to have access to any coverage.
That's not totally
because
false.
they can't afford it with these tax credits you're providing.
There's
an argument to the other side.
No, there's not. No, actually,
the subsidies are more generous.
You've got 175 million Americans that get their insurance through their employer. And frankly, right now, they're the ones who keep paying higher and higher premiums because a system that was only supposed to help people get access and require them get a government-mandated, government-run health care has actually gone amok. And so right now,
government-run healthcare, Medicare is government-run.
Right, and what's happening?
Senior citizens
and more
screaming that they want you to get rid of their Medicare.
I think you need to maybe get outside and talk to some of them, because more and more Medicaid recipients, in fact, more and more Medicare recipients, aren't actually able to get coverage. Again, it's one thing to have a card. It's another thing to walk into a doctor's office and them to tell you, we no longer accept Medicaid anymore. That's not care.
But the president's okay with...
No, he's
there
not.
There are going to be millions of people who aren't going to have coverage.
The president's goal is to provide health care coverage to every American. And right now, they're not getting that. And by giving them more choices at a lower cost, more Americans can either buy health care for their family or themselves, or in a lot of cases for their business, without paying the penalty, which is what a lot of them are doing, or forcing people into exchanges that have fewer and fewer choices. The system now is not working. The costs are going up, the choices are going down, and deductibles are going up. That is not an option. And for every American, and I mentioned this earlier, that to make this look like a choice, there isn't really a choice. The system that we have now is failing. The choice is whether we give them an opportunity to have real care, and in a way that is tailored to them in their budget. Jeff.
The manager's amendment
Yeah.
is a tacit admission that the bill as written can't pass. You wouldn't
No,
put
that's
together a
not entirely
manager's
true.
amendment if you had the votes, correct?
Well, no, I think it's a admission of what we stated at the beginning of this entire process, which is the president was going to engage with members to hear their ideas. He welcomed them. Director Mulvaney stated it multiple times, and Secretary Price, the vice president. We're not. This has never been a take it or leave it, and I've said it from this podium. The president's talked about it, as you mentioned just a second ago. This is an opportunity to hear from individuals and groups and insurance and victims of Obamacare and doctors. Hold on.
More Freedom Caucus support
It's not a
by
question of just.
dealing
It's
with
not. It's not
Medicaid
about.
or the tax credits or some other alterations.
It's not about one caucus or one member. I think no. I think this is about bringing people together. And if we have great ideas that will achieve a better outcome for the American people, then we're going to listen to them and we're going to incorporate them. That's. I don't think that this is. We have been very clear from the get-go. If you can come with a good idea that will strengthen this bill, that will benefit American patients, we'll do it. And so the manager amendment is
about getting votes, right? You can't have a strong bill that can't
no,
pass,
you
right?
can jam absolutely, but you can jam through a bill and get it out, get 218, and send it over to the Senate. But I think that we want to get the strongest bill through the House with as many ideas and opinions and facts that will help strengthen this as possible. So I'd rather, instead of getting a bill through with 218, 219, work on a process, as the Speaker and the Majority Leader have done, that brings in additional ideas, and if we can get the bill higher and higher, we will.
To Tom Cotton's point, because you talked about it just a second ago, prongs 2 and 3.
Yeah.
He went out of his way to describe that process 2 and 3, because at least the third part of that's going to require 60 votes, because
Yeah.
it's outside of reconciliation, by definition, as mythical, imaginary, and just spin. And he's telling House Republicans, don't buy into this third or second prong argument, because they, practical legislative matter, don't exist. Because you need 60 votes to get them, and so if you walk the plank, his words, not mine, on this first initiative, you're not going to get second and third phase of this process, because it can't get through the Senate.
So there's a couple things. First, this is the only vehicle that seeks to achieve what people on our side of the aisle have been talking about since 2010. This is it. If we don't get this through, the goal of repealing Obamacare and instituting a system that will be patient-centered is going to be unbelievably difficult. This is the vehicle to do that. And so we welcome Senator Cotton's ideas. But the second prong of this is administrative in nature. It is something that was delegated to Kathleen Sebelius, who is then the Secretary of Health and Human Services, to do. So prong 2 is actually fairly easy to do, because the same authority that was granted to Secretary Sebelius now is in the auspices of Dr. Price. And he has the ability to implement and work on that, and I think he noted it yesterday that his office has already been going through and doing that. So that phase is easy to do. The third prong, which is all of these things that conservatives have been championing for a long time, and frankly many Democrats agree with us on, is this ability to bring down costs through selling over state lines and allowing small businesses to group together, is something that that we've been talking about for over a decade.
And you can get 60
And I think that we can not just get 60. I think this is something that should bring people together. I think there is bipartisan, bicameral support for almost every one of these things, because they benefit. There's no one that doesn't benefit. I mean, who could be against allowing insurance to be sold over state lines? It's something that you can do your car insurance. I mean, so many. There's no other product that I can think of. I'm sure someone will fact check me on this. But for the most part, the American consumer, when you want a product, you can go online, you can go to a store, you have choice, you can go to a store across state lines. If you live in Virginia, you drive to Maryland or the district, and shop around. With our insurance, we don't have that ability. There's no question that increased competition drives down costs. That it is just an economic certainty, and allowing greater choice will do the same. And so I think respectfully, I would say to any senator that has that concern, there is no other entity that I can think of that greater choice and greater competition doesn't drive down costs significantly. And all we have to do is look no farther than Obamacare. I read off 3 of the individuals the president met with yesterday who are victims of Obamacare. In every one of those cases, the insurance premium went skyrocketing when choice and competition went away. any person that was in the individual market 8 or 9 years ago will tell you that, depending on the plan, you could get a plan for as low as $100 and change. Now the cheapest plan you can get is easily in the $300 range. And so the question that you have to ask yourself is, what changed? Competition went down and choice went down. And I think allowing both of those to re-enter the marketplace will achieve in itself that goal. And going through the additional pieces of the reform will also do the same thing. There's so many ways that we can achieve greater choice and competition that unquestionably bring down the cost of health care, that benefits every American, whether or not you're in the exchanges or you're on an employer-based plan. And again, we have to have this conversation in the context of what's going on now. Talk to somebody that's on Medicare or Medicaid. Ask them if the doctor and services that they used to be getting are available to them. I know so many times now when you walk into the doctor, they have a sign that says, "We no longer accept Medicaid." I mean, that used to be a given almost. And now, for older Americans, for Americans at the lower end of the income scale, it's becoming harder and harder to find a place that even takes your insurance. And I think that to find that an acceptable income, the question has to be asked to people who oppose this, no matter what side of the aisle are on, is what is your alternative? Because the ideas that they propose, we can incorporate. We can make this better and better. But to sit back and act as though there's a choice, doing nothing is not a choice. And that's something that the president had done. Trey.